actually lower health care costs. This will give us some hope in the future of bringing that budget into balance and not hitting that fiscal train wreck. Thank you.
Gentleman from Minnesota.
Mr. Speaker, now I am pleased to yield to a new member of this body, the gentleman from Wisconsin, Mr. Duffy, 1 minute.
Gentleman from Wisconsin is recognized for 1 minute.
Mr. Speaker, Americans have wanted health care reform for some time now, but they don't want what passed last spring. This was a 2,000-page bill that gives us more mandates and more regulation. It doesn't accomplish the goal of reducing cost and increasing access, and it puts our health care decisions in the hands of bureaucrats, not in the hands of patients and family members where it belongs. There is a better way. With today's repeal, this is the first step. Tomorrow, we begin the process of replacement with common-sense, market-based solutions that are going to bring costs down. Solutions like competition across state lines, portability, price transparency, tax parity, and allowing folks who have pre-existing conditions to obtain coverage. I look forward, starting tomorrow, to working with not only my friends here on the right, but also my colleagues on the left, to craft a bill that's going to work for the American people. Thank you very much. I yield back.
Gentleman's time has expired. Gentleman who seeks recognition.
I yield 1 minute to the gentleman from Washington, Mr. Larson.
Gentleman from Washington has 1 minute.
Thank you, Mr. Speaker. I rise today to speak in opposition to this Patients' Rights Repeal and Deficit Explosion Act. The bill before us today, according to the nonpartisan CBO, is going to add $230 billion to our national debt. We should not stand for that. The bill before us today is going to repeal efforts that we put in place to be sure that young adults can get onto their parents' insurance plans. That's going to, if we repeal this, it's going to knock 20,000 young adults in Washington State alone off of their parents' plans. If we repeal this bill today, it's going to take away help for 45,000 seniors in Washington State who are relying on the efforts that we have done over the last couple of years to be sure we're closing the Medicare donut hole. Repeal of this of the health care reform law is going to put those folks back into the donut hole. And finally, we ought to oppose repeal of this bill because of a simple fact that there's a young woman in my district who has severe mental health illnesses, and her family was able to take her onto their health care plan because of the provisions we put in there about pre-existing conditions. And that family is now saving $10,000 a year out of pocket. So I'm asking folks to oppose the repeal of this bill.
Gentleman's time has expired. Gentleman from Minnesota.
Mr. Speaker, could I inquire again as to the time remaining on each side, please?
The gentleman from Minnesota has 10 minutes. The gentleman from California has 6.5.
Thank you, Mr. Speaker. Then at this time, I'm pleased to yield 1 minute to the gentleman from Missouri, Mr. Long.
Mr. Long has.
Thank you, Mr. Speaker. I rise in support of H.R. 2. In this country, we have the finest doctors, the finest nurses, the finest protocols, the finest facilities in the world. That's not a government-run system. I swore to uphold the Constitution 2 weeks ago today in this, the people's house. The people have spoken, and they don't want Washington bureaucrats coming between them and their doctors. They'd like to make their own decisions. You can't make a silk purse out of a sow's ear, but that's exactly what the majority tried to do last year by using 10 years of taxes to pay for a 6-year program, increasing spending by $2.6 trillion. Now, that's not what I'd call affordable when that's 1/6 of this nation's economy. When I think of the 2,000-page bill, I think of a big block of cheese out there, pretty tempting looking. Well, the Americans I hear from, they don't want that cheese. They want out of the trap of government-run health care. I yield back.
The gentleman's time has expired. The gentleman from California.
I yield 1 minute to the gentleman from Virginia, Mr. Moran.
The gentleman from Virginia is recognized for 1 minute.
Thank you, Mr. Chairman, and I appreciate the leadership of the gentleman from California. So we have several dozen new Republican members of this House, and as a result, the first thing we're going to do is to attempt to repeal health care. Let me review what has happened. These new members came into office, and they were all given the opportunity to sign up for coverage for their own families. And unless they had better coverage, most of them took that opportunity. But now in the very first legislative act of this new Congress, they're going to deny that opportunity for coverage for their own constituents. So their children are covered. Their children are covered. But what about the children of their constituents? What about their loved ones? What about their businesses? They have full employment now. But what about their constituents whose employers will not be able to provide coverage for their own constituents because they repeal this law? I think it's the height of hypocrisy. Do unto others as you would do unto yourselves. Treat your constituents as you have treated yourselves. Thank you, Mr. Chairman.
Gentleman from Minnesota.
Thank you, Mr. Speaker. Now I'm pleased to yield 1 minute to the gentleman from Illinois, Mr. Dole.
The gentleman from Illinois is recognized for 1 minute.
Thank you, Mr. Speaker. Today I rise in support of H.R. 2. And what we've heard today on both sides of the aisle is how this is going to affect small business. Well, I run a small business. That's where I came from. And let me tell you that this is going to have a devastating impact for small business. What this law did is it addressed access to insurance. It does not address cost or quality. These are the things that we need to address. My health insurance rates for the people that I work with each and every day last year went up 44%. 44%. There is no question that we need reform. We need a healthy debate. We need openness in this body to actually discuss what needs to be going forward in health care. What we had last year was anything but. There was no bipartisanship in what happened last year. The only bipartisanship in last year's bill was the opposition to it. I welcome the opportunity to reach across the aisle to members on the other side to work with them to craft a bill, one that will talk about malpractice reform, one where the government will not come in between a decision that you make with your physician, and one that if you find insurance anywhere in the United States, you may purchase it.
Another 15 seconds.
Additional 15 seconds.
I appreciate that, Mr. Chairman. We have an opportunity here, an opportunity for real reform. We want that. We need that. The American people have demanded it. From American businesses and people all across the United States, they demand it. And from the other side that said we came in and had health care reform, I did not take the congressional plan. We know we can do better, and I ask that my colleagues on the other side to support H.R. 2.
Who seeks recognition?
We have two remaining speakers.
Gentleman from Minnesota.
Thank you. We're in that time of trying to balance here. At this time, I will yield 1 minute to the lady from Florida, Ms. Adams.
Thank you, Mr.
Gentlelady from Florida is recognized for 1 minute.
Thank you, Mr. Speaker. I rise today in support of repealing the government takeover of health care and replacing it with common sense reforms that will reduce the cost and increase the access to quality, affordable health care for especially my constituents in Florida. The American people have soundly rejected the Democrats' flawed government takeover of health care, and it's time to show them that their voices have been heard. The existing health care law moves this country in the wrong direction, raising taxes, Medicare, restricting private sector jobs from creation and putting power into the hands of Washington bureaucrats, rather than into the individuals themselves. Individuals want to make their own health care decisions. They don't want government making them for them. Repealing the current health care law is the first step towards keeping our pledge to the American people that we are serious about cutting spending, creating jobs, and limiting the government's role in our everyday lives. I yield back the rest of my time.
Gentlelady's time has expired. Gentleman from Minnesota.
Thank you, Mr. Speaker. Now I am pleased to yield 1 minute to the gentleman from Florida, Mr. Sutherland.
The gentleman from Florida is recognized for 1 minute. Without objection, so ordered.
I thank the gentleman from California for yielding my time. I rise in support of this legislation. As a third-generation small business owner following the footsteps of my father and my grandfather, I understand how crushing the tax burden is going to be upon small business. The NFIB estimates that 1.6 million jobs will be lost by 2014 due to this insurance mandate. 66% of those job losses will occur in small business. Like James Edens, the owner of Edens Heating and Cooling in Tallahassee, stated to me that he cannot hire additional staff due to the uncertainty. Repealing this legislation will provide much-needed certainty to small businesses around this country, allowing them to hire and invest into their employees. Thank you, Mr. Chair, and I yield back the balance of my time.
The gentleman's time has expired. The gentleman from who seeks recognition?
I think we're getting down to the sort of twos on each side, but at this time I'd be pleased to yield 1 minute to the gentleman from New Jersey, Mr. Runyon.
The gentleman from New Jersey is recognized for 1 minute.
Thank you, Mr. Speaker. I rise in support of H.R. 2 to repeal the 2010 health care legislation. The law that we seek to repeal today is not the best way to provide effective, quality health care for all Americans. I support enacting incremental reforms such as enabling individuals to purchase coverage across state lines, allowing small businesses to pool together to purchase more affordable coverage, and providing insurance companies or prohibiting insurance companies from denying coverage to those with pre-existing conditions. I urge my colleagues to support H.R. 2. Let's work together on reforms that truly reduce cost and provide quality health care. I yield back the remainder of my time.
Gentleman yields back. Gentleman from California.
Inquire the chair, how much time do I have remaining?
The time remaining is? The gentleman from Minnesota has 5. The gentleman from California has 5.5.
5.5 minutes. I yield 3 minutes to the gentleman from New Jersey.
Gentleman from New Jersey is recognized for 3 minutes. Without objection, so ordered.
Thank you, Mr. Speaker. So in the hours that we spent thus far during this debate, we could have been debating ways to help small businesses and entrepreneurs create jobs for the American people, but we did not. Instead, we have gotten the slogan, job-killing health care bill. The slogan's very much at odds with the facts. Fact is that since the health care bill was signed by the President, the private sector has generated 1.1 million new jobs. Fact is that the chief economist for Barclays says he believes that the economy is on track to add many, many jobs this year, probably 200,000 or so per month is his projection. We've heard about protecting the children and grandchildren of the country against mounting debt. You know, for years there's been an understanding here that the referee in budget disputes is the Congressional Budget Office. Through Republican and Democratic majorities, Republican, Democratic independents, they're the referee that decides what the rules are. So the Congressional Budget Office was asked by Speaker Boehner to score this repeal, and they came back and said, well, Mr. Speaker, this is going to add over $1 trillion to the national debt over the next 20 years. So the majority didn't like what they said, so they just chose to ignore it, sort of make up the rules as you go along. But what they haven't done as they've gone along is still answer the fundamental question we started for this morning. When a mother of 2 4-year-old twins goes to buy health insurance and the health insurer says, I'm sorry, we won't insure your family because your 4-year-olds have leukemia. Should that be legal or not? That's the question. The law the President signed in March says it should be illegal. This repeal says let's go back to the good old days where the insurance companies made that decision. We are not going back. We should go forward as a country to create jobs for our people and end the charade we've seen on the House floor here this morning. I yield back.
Time has expired. Gentleman from Minnesota.
Now, thank you, Mr. Speaker. I had 2 more speakers en route. They're not here, so I plan to close, and I'll reserve the balance of my time.
Gentlemen,
reserves.
and
California.
I want to thank all of our colleagues who I yield myself whatever time's left. I want to thank all of our colleagues who participated in this debate today. I think it's shown some fundamental disagreements and some fundamental differences. First of all, there's a strong suggestion here from an NFIB study that was done before this law was ever written, that has nothing to do with this law, saying you might lose jobs. But what do we see since the law has passed? We see that for employers of under 10 employees, health care coverage has risen by 10% because we've made it less expensive for small businesses to offer that health insurance. That's not a self-interested study. What you see from United Healthcare, the largest health insurer in the country, 75,000 new customers to their health plans from employees of small businesses because the small businesses find it affordable to extend health insurance as a benefit of working for that small business. Blue Cross Blue Shield of Kansas City says the number of small businesses buying insurance since April for the first month after the legislation was signed has jumped 58%. Small business employers are for the first time able to extend insurance, affordable insurance, to their employees. And that's why the job creation that Mr. Andrews referred to of a million jobs since the passage of this bill is continued and expected to continue. That's why it's different than the history prior to the Obama administration, when over 8 years, almost 800,000 jobs were lost during those years of the Bush administration. But there's something more important in this legislation, and that is whether or not families will have the control of their health insurance destiny, whether they will have the freedom to make these choices. Many on the other side of the aisle said this is a bureaucratic system. Has anybody, any family in America, any single mother, any spouse, any child, any grandparent met a more bureaucratic system than the American health insurance system? There is no more bureaucratic system. When you send in your premium, they tell you you sent it the wrong place. When you send in your bill, you send it to the wrong person. When you send it to the right person, they say that person's left their job. When you say, I went to the doctor, they say you should have called this first. When you say, I had emergency surgery, you should have called this first. We're not covering it. You want to talk about bureaucracy, ladies and gentlemen, and that's why this legislation is growing in popularity, because small businesses see, senior citizens see, parents with children under 26, they see a chance to liberate themselves from the most arbitrary, the most capricious, the most bureaucratic system in our entire free economy, and that's the insurance companies. Everybody has been run around the block by their insurance companies. It's something they all share. It's almost the problems they share with their cable company. Not quite, but it's not as dramatic here, because this is life and death. This is the security of your family. This is whether or not you can change jobs. This is whether or not your children will be protected. This is whether or not your parents will be able to afford their prescription drugs, because that's what this legislation enables and gives the freedom to American families to have. Repeal, we go back into the clutches of these bureaucrats spread across the world in the insurance company. You call for help and you reach somebody in another country, in another time zone, with no understanding of the emergency that your family, your child, your grandparent, your parent faces. Nobody wants to go back there, ladies and gentlemen. Nobody. They've been there for 50 years, and health care costs have gone up faster than any other segment in our economy. Faster than anything you can imagine. Faster than a speeding rocket. Faster than a speeding airplane, faster than Superman. Health care costs have gone up because of the insurance bureaucracy.
Gentleman's time has expired. Gentleman from Minnesota.
Thank you, Mr. Speaker. I actually don't know anybody who is supporting the red tape of the insurance company. What I find interesting is that we think it's a better solution to add thousands of pages of new government regulations and thousands of new government bureaucrats on top of that system and think somehow it's going to be better. Let me address a couple of things that have come up in this debate and some things we discussed in the past. One of them is the cost of this bill, and other committees have talked about it and will again. There have been claims today that repeal will cost the taxpayers variously $230 billion or $1 trillion. Based on what the CBO has said. And we find that incredible, that repealing this job-killing legislation is actually going to cost us money. And so the question comes, why are these things different? And it turns out there is a wonderful piece in Wall Street Journal today that addresses that specifically, and I'll just quote it. It says, how then does the Affordable Care Act magically convert $1 trillion in new spending into painless deficit reduction? It's all about budget gimmicks, deceptive accounting, and implausible assumptions used to create the false impression of fiscal discipline. And we heard some words today addressing that fact. Some of our physicians pointed out that in order to get the numbers to add up, you have to assume that we're going to continue to punish physicians who are providing Medicare services, and there is nobody in this body that believes that we're actually going to do that, nor did they believe we were going to do it when that sort of gimmicky accounting was used to justify the cost in the first place. We've heard discussions about how this is a very good deal for businesses, large and small, and yet if you look at associations, organizations that represent businesses across America, they're saying today, not just 6 months ago or a year ago, but saying today that they support repeal of this job-killing legislation. And a short list, just some of them, are the National Federation of Independent Businesses, the National Retail Federation, the National Restaurant Association, the U.S. Chamber of Commerce, the International Franchise Association, the American Bakers Association, American Hotel and Lodging Association, the National Stone and Gravel Association, and on and on. Businesses do not like this government takeover of health care, and they support repeal. This is not a good deal for businesses. My colleagues on the other side of the aisle chose to focus their remarks on a handful of provisions included in the law that are more attractive than tax hikes, penalties imposed on employers, and higher health care costs. And no one is disputing that such provisions exist, but it is wrong to suggest that the only way to reform health care is to bankrupt our nation with this albatross. I believe we can improve health care without orchestrating a government takeover. That is why I look forward to casting my vote to repeal this law so we can move forward to carry out the wishes of our constituents. Repeal is the first step toward the right kind of reform. Thank you, Mr. Speaker. I'd like to yield back and request unanimous consent that any minute or two that I have left be granted to the chairman of the Energy and Commerce Committee during that portion of the debate.
Without objection, the gentleman from Michigan will control the time. The chair will remind all persons in the gallery that they are here as guests of the House and that any manifestation of approval or disapproval of proceedings is in violation of the rules of the House. Gentleman from Michigan.
Mr. Speaker, Parliamentary Inquiry. I might just ask how much extra time we might have been given by Mr. Klein from Minnesota.
The gentleman has 1.5 minutes.
1.5 minutes. Great.
By Mr. Klein.
Mr. Speaker, I would yield myself 2 minutes.
Gentleman's recognized.
Mr. Speaker, today we take a step towards compassionate, innovative, and job-creating health care. It's ironic that we must end something to realize a new beginning. But that's exactly what Obamacare has compelled us to do, and that's precisely what we will do today. It's time to be honest with the American people. Remember the Hippocratic Oath? First, do no harm. Obamacare produces the opposite of growth, compassion, and innovation in health care. It destroys jobs, busts budgets, creates an unsustainable set of mandates on individuals, employers, and states. It will stifle innovation and the development of life-saving medicines. It will make health care more expensive, not more affordable. Mr. Speaker, that's not compassionate. That won't produce innovation, and that's why repeal is the first step towards a better beginning. What's compassionate about forcing employers to provide insurance that they cannot afford to employees who will lose their jobs due to Obamacare? What's compassionate about creating a rigid new entitlement that states are commanded to fund with money that they simply do not have? What's compassionate about cutting over $200 billion from the Medicare Advantage program, leaving seniors with fewer services, higher copays, and more out-of-pocket expenses? What's compassionate about shackling more Americans with greater government dependence? Obamacare was erected on a foundation of false promises. If you like your health insurance, you can keep it. Health care premiums will go down. Employers will not drop coverage. Seniors won't see any changes in their Medicare benefits. Today, we know that those were only slogans, sound bites, and a cynical sales pitch, and certainly not promises kept. Yes, today, repeal will pass in the House. We will then embark on reform that I believe can be supported by both Republicans and Democrats. I yield myself an additional minute.
One additional minute.
Ensuring those with pre-existing conditions have access to affordable coverage. We'll do that. Allowing families to include their children up to 26. We'll do that. Medical liability reform to reduce the unneeded cost of defensive medicine. We'll do that. Provide incentives for employers rather than penalties, and mandates that will cost jobs and depress wages. We'll provide those incentives. Yes, we will. Those are just some of the principles that I believe we can agree on with both sides of the aisle. So first is repeal, then replace. I'm ready for the challenge to put real health reform back together that is bipartisan rather than partisan and achieves the goal of lower health care costs for every American family. Reserve the balance of my time.
Gentleman reserves the balance of his time. Gentleman from California.
Mr. Speaker, I yield myself 3 minutes.
Gentleman recognized for 3 minutes.
I strongly oppose this effort to repeal the health care bill. Millions of Americans are already benefiting from this legislation. Insurers have stopped discriminating against sick children. Seniors are saving money on prescription drugs, and small businesses are receiving billions of dollars in tax credits to provide health care coverage. Repeal will roll back these benefits. The repeal bill reminds me of the story of Robin Hood, but in reverse. Repeal will take essential health benefits from millions of struggling Americans and give new powers and profits to insurance companies. If we repeal health reform, there will be no prohibition on discrimination against over 100 million Americans with pre-existing conditions. No prohibition on insurance companies canceling your coverage when you get sick. No prohibition on lifetime caps and annual limits. No required coverage for young adults on their parents' policies. No assistance to seniors struggling to afford the cost of drugs in the donut hole. No free annual checkups and preventive care in Medicare. No tax credits for families and small businesses to pay for health insurance. These changes will affect every congressional district in the country, and my staff has been analyzing what the impacts of repeal will be in each district. These are now available on our website. They tell a compelling story. We have a new member on our committee from West Virginia. In his district, repeal will mean increasing prescription drug costs for 12,000 seniors and taking new preventive care benefits from over 100,000 Medicare beneficiaries. We have another new member on our committee from New Hampshire. In his district, repeal will mean eliminating tax credits for nearly 17,000 small businesses. In my own district, repeal would mean over 50,000 constituents would lose protections against rescissions. And these aren't just statistics. Behind every number is a real person with real problems, like diabetes or breast cancer or a child with special needs. Repeal is a boon for the insurance companies, but an enormous setback for American families. If we pass this bill, the insurance companies can raise their rates, discriminate against millions of Americans with pre-existing conditions, and cut off coverage when someone becomes sick. There are many reasons to oppose repeal. The health reform bill is creating thousands of new jobs. It will cut the deficit by curbing the growth of health care costs, saving taxpayers over $1 trillion. This is why I urge members to vote no on this legislation. If there's a change the Republicans want to make, let them propose it. But don't throw it all out the window and say they're going to do all these things we've already done. I urge members to oppose this legislation and reserve the balance of our time.
Gentleman reserves the balance of his time. Gentleman from Michigan.
Mr. Speaker, I would yield 2 minutes to the Chairman Emeritus of the Energy and Commerce Committee, Joe Barton, whose state could lose perhaps 64 hospitals that would close with the continuing of Obamacare.
The gentleman from Texas is recognized for 2 minutes.
Thank the gentleman, and I look forward to working with him as the chairman of the committee. Mr. Speaker, I would ask unanimous consent to revise and extend.
Without objection, so ordered.
Mr. Speaker, before I begin to discuss health care, would like to say that our prayers continue to go out to Congresswoman Giffords in Arizona. We are very gratified to learn of her continuing progress. We hope that sometime in this Congress she does come back to the House floor and give her voice to the voice for her constituency. We all miss her and we wish her the very best. Mr. Speaker, we are here today because the existing law of the land on health care is fatally flawed. Most of us think it is unconstitutional. We think it is overreaching. We think the federal government is intervening more and more into the daily practice of health care between the doctor-patient relationship. And we think it needs to be repealed before it does irreparable harm to our health care system, which is the best in the world. We think that on basic principles it's unconstitutional. We believe that you shouldn't have the federal government mandate that an individual has to have health insurance whether he or she wants it. That particular constitutional question is wending its way through the courts, and we hope soon to have an answer to that question. We want to repeal today so that we can begin to replace tomorrow. We want to deliver on our pledge to America that we meant it when we said if the American voters gave us the majority, we would repeal this existing law. And that is step one. But step two is to replace it. I see that my good friend from California, Congresswoman Eshoo, is on the floor. She and I have an amendment in the new law on biosimilars that passed with a huge bipartisan majority, and we hope that that's one of the things that will be kept. We do believe that we should be able to do something on pre-existing conditions. We do believe that children should be allowed to stay on their parents' plans until the age of 26. So there are some things in the new law that we think are worth keeping. But until you sweep away the bad things, we cannot begin to work on the good things. So, Mr. Speaker, with all due respect, we hope that we can repeal it on a bipartisan basis in the House, and then under the leadership of Mr. Upton and Mr. Camp and others, begin to replace it tomorrow. Please vote to repeal this law today.
Gentleman's time has expired. Gentleman from California.
Mr. Speaker, I yield the control of the balance of our time of the Energy and Commerce Committee to the distinguished gentleman from New Jersey who chaired the Health Subcommittee in the last Congress and who has done a great deal to advance this legislation, Mr. Frank Pallone.
Without objection, the gentleman from New Jersey will control the balance of the time.
Thank you.
Gentleman from New Jersey.
At this time, Mr. Speaker, I'd like to yield 2 minutes to the Dean of the House of Representatives and the House sponsor of the health reform legislation, Mr. Dingell.
The gentleman from Michigan is recognized for 2 minutes.
I thank my good friend. I ask unanimous consent to revise and extend my remarks.
Without objection, so
well,
ordered.
so much for openness and transparency. We're going to do all this without any hearings, without knowing what's going on. But I'm going to tell you a little bit on my Republican side of the aisle here about what this is really going to do. Insurance companies will be able to deny 292,000 individuals in my district, including 33,000 children, an opportunity to have health insurance. And pre-existing, and this will be because of pre-existing conditions. They're going to increase the number of uninsured in my district, the 15th of Michigan, by 20,000. They will increase the cost of hospitals for providing uncompensated care in the 15th district alone by $182 million. They're going to cost each American $1,000 more because they're not going to, because the uninsured are going to go in and get health care anyhow. I want to tell you what's going to happen to one young lady who has a terrible condition called endometriosis. She's going to receive now health insurance through the legislation passed because that insurance will flow to her until she's 26 on her father's insurance. But you're going to take that away from her. And you're going to see to it that the donut hole doesn't close because of the fact that you are saying no longer is this law going to be in effect. We want to see to it that the American people benefit of this. And the repealer that you're talking about today will see to it that they do not. What's it going to do to the deficit? Add $1.4 trillion to the deficit. It's going to do more than that. It's going to add $230 billion to the annual deficit. And it's going to see to it that Americans can no longer be assured that they are going to not have their health insurance canceled because of a sickness which occurs to them. It is going to hurt small business because it's going to take billions in tax benefits away from small business who would do this. I urge the House to vote down this outrageous piece of legislation.
Gentleman's time has expired. Gentleman from Michigan.
Mr. Speaker, at this point I would yield a minute to the Chairman of the Oversight Investigation Subcommittee from Florida, Mr. Cliff Stearns.
Gentleman from Florida is recognized for 1 minute.
Yes, unanimous. Consent to revising extent.
Without objection, so ordered.
Mr. Speaker, let me give you some important reasons why we need to repeal this law. Yes, it will create jobs, but in an ever-expanding federal bureaucracy. The Joint Economic Council Committee reported this bill creates over 150 new federal offices. With that, of course, small businesses must comply, are mandated to comply to all the new and many regulations. Now, if this bill is so good, why is the Obama administration giving a pass to over 220 organizations and corporations that have received an exemption from this law, including many, many unions? With the proposed $500 billion cut in Medicare, the increase in taxes that are already occurring, this law is simply not credible. With record unemployment, this law will hurt small businesses, prevent job creation, adding burdensome taxes, and it will not increase growth in this country. Now, Republicans will replace this bill with a health care law based upon choice, competition, and traditional American exceptional value system, which is compassion, but compassion with accountability. We need to repeal this law.
Gentleman's time has expired. A gentleman from New Jersey.
Thank you, Mr. Speaker. I yield myself 2 minutes.
Gentleman's recognized for 2 minutes.
Thank you, Mr. Speaker. I wanted to thank my colleague from Florida who just spoke for saying and admitting that the health care reform does create jobs. Because if you listen to the Republicans, they've been saying over and over again that that's not the case. But he finally said, yes, it does create jobs. And that's what we really should be doing here. We should be creating jobs, improving the economy, not talking about repealing the health reform, which already is providing so many benefits to many Americans. Now, yesterday I saw a statement from our former Republican Majority Leader, Senator Frist from Tennessee, who said that we shouldn't do the repeal. He recognized the fact that this is legislation, that this health care reform is actually making a difference in people's lives, and that we should build upon it, as Senator Frist said, a Republican, rather than just trying to do an outright repeal, which is a complete waste of time. Now, what I'm hearing from my constituents is they like the benefits that already are coming out from the health care reform. Whether it's eliminating all the discriminatory practices like lifetime caps or pre-existing conditions or annual caps or being able to put your children up to 26 on your policy, these benefits have already kicked in, and Americans are actually like the benefits. They understand why they're helpful to them. The only group that I can think of that actually would benefit from repeal are the big insurance companies. And unfortunately, that is the bidding, if you will, that the Republicans are doing on the other side of the aisle. The insurance companies want to continue to increase premiums by more than double-digit. They don't want their to cut into their profits. One of the things that kicked in January 1st is a provision that says that 80% of your premiums have to actually go to provide benefits, can't go to the shareholders or for the profits of the insurance companies. The insurance companies are the only ones that benefit from repeal because they can raise premiums, they can have discriminatory practices, and they just increase their profits. I used an example. I think the gentlewoman from New York, Ms. Slaughter, used this example before about someone who has breast cancer. And now, because of the policies, I just yield myself another 15 seconds, if you will,
Gentleman's recognized
Mr. Speaker.
15 seconds.
Now, because of the policies of the health insurance reform, if somebody has breast cancer and they have a recurrence, they will not experience a lifetime cap or an annual cap. They'll be able to go back and have chemotherapy or whatever is necessary. Those are the types of benefits that have kicked in, and they should continue. We should oppose repeal.
Gentleman's time has expired. Gentleman from Michigan.
Before I yield a minute to the gentleman from Kentucky, Mr. Whitfield, I'd like to yield 30 seconds to Mr. Stearns.
Gentleman from Florida is recognized for 30 seconds.
I thank my colleague. Perhaps the gentleman from New Jersey didn't listen to me when I just spoke. It's creating 150 new government agencies, and these are all government jobs. So if you're talking about increasing jobs, it's government jobs. It also includes $500 billion in taxes, burdensome 1099 paperwork requirements, according to a study by the nation's largest small business association, the NFIB. I'd like you to talk about that 1099. So these employer mandates that are in the health care bill are terrible, and it's estimated it'll wipe out 1.6 million jobs over just 5 years.
Gentleman's time
has
expired.
I caution the gentleman from New Jersey, listen carefully to my speech.
Gentleman from Michigan.
Yield a minute to the gentleman from Kentucky, Mr. Whitfield.
The gentleman from Kentucky is recognized for 1 minute.
I'm delighted we have the opportunity today to revisit the health care bill that was passed last year. I'm delighted because, first of all, when the bill came to the floor last year, this bill affects every aspect of health care in America, and we did not have the opportunity to offer one amendment on the floor. In addition to that, this bill takes $500 billion out of Medicare, which means less money to nursing homes, hospitals, and Medicare beneficiaries. And then the claim that this would reduce the deficit by $138 billion was calculated by including 10 years of tax revenues under this bill, but only 6 years of expenditures. And then how can you claim that we're supporting insurance companies by repealing this bill when the insurance companies supported the bill? And they supported the bill because it mandates that small businesses and individuals buy health insurance. So I would urge the repeal of this legislation, and then we can fix health care the way it should be fixed.
Gentleman's time has expired. Gentleman from New Jersey.
I yield now 2 minutes to the gentleman from Massachusetts, Mr. Markey.
Gentleman from Massachusetts is recognized for 2 minutes.
I thank the gentleman. This Republican bill is the wrong prescription for our country. It isn't just a repeal, it's a bad deal. It's a bad deal for middle-class families and small businesses who would lose tax credits included in the new law to help them pay for health insurance. It's a bad deal for grandma who will face higher costs for the life-saving medications she needs. It's a bad deal for pregnant women who could be denied coverage when they need it the most. Lydia Swan, my constituent, shared her story with me during the health care debate last year. Lydia was pregnant when her husband switched jobs. Her new insurance company said her pregnancy was a pre-existing condition and they wouldn't pay any expenses. So Lydia was insured, but she wasn't covered. That is wrong. It is just plain wrong. Mr. Speaker, a newborn child should be a pleasure and not a pre-existing condition. New parents expect some sleepless nights. They don't expect their insurance company to deny coverage for the pregnancy. New parents should worry about the baby and not about the medical bills. The new health care law closes the book on these kinds of insurance company abuses. Let us not today reopen it once again. Say no to this Republican bad deal that takes away patients' rights and freedoms, and say yes to a health care system that protects American families.
Gentleman from Michigan.
Mr. Speaker, before I yield a minute to the gentleman from Illinois, Mr. Shimkus, I'd like to yield 30 seconds to the gentleman from Georgia, Dr. Gingrey.
The gentleman from Georgia is recognized for 30 seconds.
Mr. Speaker, I thank the gentleman for yielding. The gentleman from Massachusetts must not be familiar with a waiver under the Medicaid program called Katie Beckett. The poster that he showed us of the young child with pre-existing conditions. This program, Katie Beckett, still exists. This waiver, this opportunity for children with pre-existing conditions to get coverage. The Democrats are also disingenuous when they claim credit for immediately covering children with pre-existing conditions. Obamacare got it wrong. They did not guarantee that children would have their pre-existing coverage covered. It's ironic the legislation was actually drafted incorrectly. And
Gentleman's time has expired. Gentleman from Michigan.
Minute to the gentleman from Illinois, Mr. Shimkus.
Gentleman from Illinois is recognized for 1 minute. Without objection, so ordered.
Thank you, Mr. Speaker. My friends on the Democrat side, they're supporting this bill based upon 10 pages of the legislation. Immediate access to insurance for the uninsured, extension of dependent coverage, no lifetime annual. 10 pages. This health care law was 2,990 pages. This is only volume 1. And what do you find when you go through the entire bill? This is what they're defending their bill on. This is only volume 1 of 4. And what's in here? $500 billion cut to Medicare. $500 billion cut to Medicare for our seniors. What else is in here? $500 billion of tax increases. What else is in here? 6 years of benefits for 10 years of costs. What else is in here? A new entitlement program. Our nation is broke. It is broke because of our entitlement programs, and this law added a new entitlement.
Time has expired. Gentleman from New Jersey.
I yield 2 minutes to the gentlewoman from California, Ms. Eshoo.
The gentlelady from California is recognized for 2 minutes.
I thank the chairman. Mr. Speaker, I rise in opposition to what I think is really an unwise, unwarranted, and unfair effort to repeal the historic health care law, which has brought much-needed insurance reforms to the American people. For the first time in our nation's history, Congress passed legislation to ensure that every American has a comprehensive health insurance plan, just as members of Congress have. We reduced the deficit by $143 billion over 10 years and $1.2 trillion over 20. I want to tell an important story, which I think underscores why repeal is wrong. Ronit Bryant in my district was battling stage 4 breast cancer. That's the worst. When her HMO decided to stop paying for her treatment. In the middle of her treacherous ordeal through a mastectomy, chemotherapy, a bone marrow transplant, and radiation, she was also battling her insurance company in federal court, where she had to listen to lawyers argue over whether her life was worth saving or not. A woman of less strength would never have made it through this. I'm proud to say that Ronit made a full recovery. She watched her children grow, and she went on to become the mayor of one of the major cities in my district, Mountain View, California. So a 50% discount on prescription drugs for seniors makes sense. Prohibiting rescissions, what was done to Ronit, eliminating that, makes sense. Allowing children to stay on their parents' insurance policy until the age of 26 makes sense. 35% tax credits for small businesses makes sense. What the Republicans are doing today does not make sense. It's wrong for America, it's bad for Americans, and I urge my colleagues to reject it.
Lady's time has expired. Gentleman from Michigan.
Mr. Speaker, at this point I yield 2 minutes to the chairman of the Health Subcommittee, Mr. Pitts.
The gentleman from Pennsylvania is recognized for 2 minutes.
Thank you, Mr. Speaker. I might just respond. Obamacare spends over $1 trillion, but leaves 23 million people uninsured. Mr. Speaker, my colleagues on the other side of the aisle have been arguing that we can't afford to repeal Obamacare. I would argue just the opposite. Our country cannot bear the true cost of Obamacare, and it must be repealed. Our repeal would mean that Americans with employer-provided health coverage will keep their current plan. Yet the administration estimates that 7 out of 10 individuals will lose their current coverage under Obamacare. Our repeal means that half of all employers, as many as 80% of small businesses, will be able to keep their current plan rather than lose it over the next 2 years. The administration estimates reveal that their own onerous regulations will force most businesses to give up their current plans, subjecting them to costly new mandates that will increase premiums. Our repeal means that 7.4 million more seniors will participate in Medicare Advantage plans, according to Medicare actuary,
Our repeal also means that the Medicare Advantage beneficiaries will not face an average increase of $873 per year in out-of-pocket costs between now and 2019. Our repeal means that individual health insurance premiums will not increase by $2,100. Our repeal means that taxpayers will not face $569 billion in tax increases scheduled to take effect over the coming years. Our repeal means that the economy would keep an estimated 750,000 jobs that will be lost because the incentives included in Obamacare actually discourage individuals from working, according to the CBO. Our repeal means that national health spending will go down by $310 billion, according to the Medicare actuary. Our repeal means that seniors' Part D premiums won't increase by 4% in 2011, or rise up to 9% in 2019, as CBO estimates would happen under the current law. Without repeal, employer-retiree drug coverage will drop from 20% of retirees to 2% by 2016, according to the Medicare Trustees Report. Finally, repeal means that states will avoid a massive forced expansion of their Medicaid programs at the cost of $20 billion to the states at a time when they cannot sustain Medicaid. The cost of leaving this job-killing health care law in effect are much too high. It must be repealed.
Gentleman's time has expired. Gentleman from New Jersey.
Mr. Speaker, I yield 2 minutes now to the gentleman from New York, Mr. Engel.
The gentleman from New York is recognized for 2 minutes.
I thank the gentleman for yielding to me, and I'm very, very sorry that my Republican friends have chosen to put this repeal bill through. In light of the events in Tucson, we all say we are going to work together. The American people want us to work together. This is not the way to do it. If there's a problem with the bill, we should tweak it or change it. We shouldn't repeal it. If there is a problem and things need to be changed, we should put our heads together and try to do it. This repeal bill, the Republicans say that they want to cut costs in government. The CBO says that this bill will save us $230 billion over 10 years and $1.2 trillion over 20 years. And the first thing the Republicans bring up is to repeal this bill, which will add to the deficit. This is political theater. It's a charade. This isn't going to be repealed. Let us put our heads together and figure out what makes sense. All important bills that were put in the past 50 or 60 years, from Medicare to Medicaid to Social Security to the civil rights bills of the 1960s, they needed to be tweaked as we saw what the problems are. I'm willing to change the bill, but repealing it is the absolutely wrong way to do it. I'm delighted to revisit this issue because we can finally get the truth out. The American people understand that right now, if they have a pre-existing condition, they cannot be denied coverage. An insurance company right now with this bill cannot say, sorry, you have a lifetime cap or an annual cap and we're not going to insure you. The insurance company now can't deny your 24 or 25 or 26-year-old child insurance to be on your plan. We're finally closing a donut hole to put more money in the hands of senior citizens. This is what the Republicans would repeal. They say that this is a government takeover of health care. No, it isn't. And if they had better plans for health care, they were in power for 6 years with the President and both houses of Congress, and they did nothing to make health care affordable for the American people. Let's work together. Let's change the bill. Let's tweak the bill. Don't repeal it.
Gentleman from Michigan.
Mr. Speaker, at this point I would yield 1 minute to the Vice Chair of the full committee, the gentlelady from North Carolina, Sue Myrick.
The gentlelady from North Carolina is recognized for 1 minute.
Thank you, Mr. Speaker. We oppose this health care law for many reasons, and I'm especially concerned about the negative effect it may have on the ability of our doctors to care for their patients as they see fit. It creates well over 156 bureaucracies, programs, regulatory systems, which will further regulate, control the way medicine's practiced, paid for, and allocated. You know, doctors who practice medicine as small business owners are already forced to dedicate significant resources and manpower to keep up with the bureaucracy of reimbursement alone. This law does nothing to slow the growth of Medicare and Medicaid programs. We know those are two huge problems we have to deal with. But it'll surely add to the regulatory burdens faced by doctors, patients, and most importantly, the American people who are going to have to foot the bill. And I yield back.
Gentlelady yields back the balance of her time. Gentleman from New Jersey.
I yield 2 minutes now to the gentleman from Texas, Mr. Green.
Gentleman from Texas is recognized for 2 minutes.
Thank you, Mr. Speaker. And as a member of Congress from Texas, I supported the health care reform law proudly. Texas has some of the highest rates of uninsured in the United States. 26% of our Texans are uninsured, 6.4 million residents compared with the national average of only 16.7%. Over the past 8 years in Texas, employer-based insurance coverage has dropped 18%. Now only 48% of Texans have health insurance provided by their employers, well below the national average. Texas has some of the highest health insurance premiums in the U.S. A family of four making $44,000, the average premium out of pocket is $6,548, almost 15% of their income. Almost 15% of their income. In Texas, our State Department of Insurance report to the legislature acknowledged the positive impact of the Affordable Care Act. In this report, and I ask unanimous consent to place it into the record, Mr. Speaker.
Without objection, so ordered.
The Texas Department of Insurance concluded the Affordable Care Act will have positive impact on the state and help Texans gain access to private insurance coverage. As the Department of Insurance report states, the removing of underwriting restrictions, new premium rating reforms, availability of subsidies, and limitations on out-of-pocket expenses for low-income and middle-income families should make it easier for many lower-income Texans to obtain private insurance. In Houston, our district, in Harris County, 40% of my constituents are uninsured. When we passed the Affordable Care Act in March of last year, H.R. 2 would be a repeal of H.R. 2 would be a major setback to what we're trying to do in our own district. To cite a few local statistics from the repeal on my constituents, increase the number of people without insurance by almost 217,000, allow insurance companies to deny coverage to at least 102,000 people in our district, including at least 12,000 children with pre-existing conditions, eliminating health care tax credits for 14,600 small businesses and 177,000 people, increased prescription drug costs for 4,400 seniors in my district who fell into that donut hole except for for health care reform. My Republican colleagues want to work on improving it. I'm here to do it, but repeal is not the answer.
Gentleman's time has expired. Gentleman from Michigan.
Mr. Speaker, at this point I yield to the gentleman from Oregon, Mr. Walden, whose state would be devastated with the Medicare Advantage cuts.
How much
1 minute.
The gentleman from Oregon is recognized for 1 minute.
Thank you, Mr. Chairman. 42.7% of Oregon seniors, that's about 200,000 in Oregon, nearly 41,000 in my district, were enrolled at the time this law was established in Medicare Advantage programs. You know, under this bill, under this new law, Medicare gets whacked by $500 billion, and the reports indicate 1 out of 2 seniors might lose their Medicare Advantage across the country. Look, I want a patient-centered health care system. It's your life. It's your health. You should have the right to choose your doctor and your hospital and make those decisions. We will address with our replacement bill pre-existing conditions, making sure kids who are in college or up to 26 or whatever the age is decided by the committee are going to be able to be covered by your insurance. But I'll tell you what, in the law that is on the books today, it drives up the cost of health care, it drives up premiums, and it adds to the nation's debt when you look at it in the long term, according to CBO. The manager at Taurus Freight, a small freight logistics business in Bend, Oregon, told me recently, because of the 1099 reporting provision in this bill, she's going to quit buying from various businesses, consolidate. It's going to cost jobs and put new headaches on small businesses.
Gentleman's time has expired. Gentleman is recognized for an additional 30
seconds. And I think that's one of the big arguments here that I get from the people out in my district, is why did the government take over this, put all these other provisions in, ram a bill through the House that creates this new $1 trillion entitlement that costs jobs and doesn't drive down the cost of health care. We can do better than this given the chance, and under the Republicans, the committees will actually have a chance to work on a bill for replacement, and everybody can participate from both sides of the aisle, and we'll get it right and get to a patient-centered health care system in America that does reform the current system and drives down costs.
Gentleman's time has expired. Gentleman from New Jersey.
Mr. Speaker, I yield now 1.5 minutes to the distinguished chairwoman of the Rules Committee. Did I say former chair? I apologize. The ranking member of the Rules Committee, the gentleman from New York.
Is recognized for 1 1/2 minutes.
I thank the gentleman for yielding, and I speak to you today on behalf of the women of America, the millions of whom I will never meet, but are set to receive countless protections from the Affordable Care Act by the time it is fully implemented in 2014. Health care reform is a major victory for women, and any attempt to repeal or defund this legislation is simply unfair to us, our daughters, our mothers, and our granddaughters. The fact of the matter is that the Affordable Care Act ends the widespread discrimination that has existed and will come back against women in the health care system. It took us decades until we passed this bill to make it illegal, finally, for insurance companies to charge women higher premiums and stop the egregious practice of charging them 48% more and to not cover domestic violence victims. Yes, that's right. In 8 states and the District of Columbia, insurance would not cover victims of domestic violence on the grounds, I assume, that it might happen again. Equally egregious, women were routinely denied health insurance if they had children. Many places, pregnancy was considered a pre-existing condition, as were D&Cs. But both of those reprehensible practices are outlawed in the passage of the Affordable Health Care. Thanks to the new law, women do not have to worry anymore about being treated as second-class citizens or being discriminated against for being a woman. But that's not where the benefits end. When it's fully implemented, all maternity services will be included in health insurance plans. They will no longer be able to deny coverage or higher premiums with people who've had C-sections or pregnancy. And I will thank you very much. Put the rest in the record.
Gentlelady's time has expired. Gentleman from Michigan.